Hi guys, today I am making a video about ovarian dermoid cysts or mature cystic teratomas, ovarian torsion, cystectomy procedure, the surgical procedure to remove the cyst, and a little bit about my Paragard IUD. So I'm making this video because I recently was diagnosed with a mature cystic teratoma, and I had the surgical procedure 1 week ago today. And whenever I was going into this, I really wanted to know more about it. And I'm a little bit of a nerd. I'm a nurse, and I really find the medical aspects of this interesting. So I wanted to gather as much of that information as I could for everyone else, and since it's me, I'm not breaking HIPAA when I'm talking about any of this, so it's awesome. So I hope that I can help some people feel better about the procedure or learn about this. I don't know, but if you're watching, I'm glad you're here. So yeah, I'm gonna get into my story. I have some notes with me, so I'll be looking at these periodically, but so my story started out when I got my Paragard IUD inserted. I got my Paragard IUD inserted on August 3rd, and then everything went well, and that was fine. And I have a blog about that on my blog, and I'll link that below. But so I got that in, and then on August 7th, so I believe the 3rd was a Wednesday. Let me look at my calendar. The 3rd was a Thursday, and then on that following Monday, August 7th, I woke up with the most excruciating pain I've ever felt in my life. So of course, just getting my IUD in, I thought that my IUD had perforated, or I don't know, something crazy happened. I didn't know what happened. So I was in pain from, I woke up at 8 a.m. in this excruciating pain. It didn't feel like it was where my uterus was. It felt like it was where my ovary would be. It was only on one side. It was on my right side. And, I didn't know what it was. It didn't feel like a period cramp. It didn't feel like anything I've really ever felt before. It was a sharp stabbing pain that kind of came, and when it came, it was bad, and then it would go, and I would be okay, but I was still in pain. But so yeah, I woke up with that pain on August 7th, and I called my doctor's office, and of course my regular doctor was out of town. But anyways, they scheduled me for an ultrasound later that day. My ultrasound was scheduled at 1, so I had a while to wait, and I was really worried about that because I was in so much pain, and I didn't know what was going on. But I ended up taking ibuprofen around 10 or 10:30, and my pain, kind of went away. Not completely, like it was still coming and going, and just really like tender on the right side. But it wasn't how full force it was whenever I woke up. So I get to the ultrasound, and I have a pelvic ultrasound. So you'll get a pelvic ultrasound. That's an intravaginal ultrasound, and they also did an ultrasound on top of my belly as well. So long story short, they found a large mass on my right ovary. My left ovary looked completely normal. They were still finding some blood flow to my right ovary. But anyways, the doctor rushed in, and she was like, I think that you need to go to the hospital right now because it appears that you're having an ovarian torsion. And we kind of talked, and I said, my pain's not as bad as it was this morning. I probably am kind of coming out of an ovarian torsion. So we decided to wait and not go to the hospital that day. And then I met with another doctor that same day to discuss it was an OBGYN. The lady who was frantically coming in, she was like a OBGYN radiologist type of a lady. So she reads ultrasounds and that kind of thing. So we went, and I met with a doctor, and he said that my cyst looked like it could be two different things. It could be a hemorrhagic cyst, meaning it's filled with blood and it would go away on its own. And he thought that possibly I had an ovarian torsion and that it backed up all this blood flow into where my ovary would be. So he said it could be that. So we're gonna wait a week. If you can wait a week, then we're gonna wait a week. When you're in pain, you don't wanna wait a week. Or it could be what they call a dermoid cyst or a mature cystic teratoma. So he suggested I waited a week and got an ultrasound the following Monday, which I ended up doing. But I was supposed to go on vacation on Wednesday. So I had this ultrasound on a Monday. I was supposed to be leaving to go to Yosemite and San Francisco on that Wednesday. And he said, I don't feel like you should go, because if you are gonna get a torsion and you're gonna be in the middle of the wilderness in Yosemite with no hospitals around, you know, your ovary and its surrounding structures can die, and it's considered a medical emergency. So he suggested that I cancel my vacation, which was a real bummer for me because I was really looking forward to that. I just graduated college. It was like my hoorah before I started work. But so yeah, I canceled my vacation because when you feel that pain that I felt on the Monday, I did not want to go through that, especially like in the woods. Like, no, I just was not doing that. So I went for my following ultrasound the next Monday. So I went for my first ultrasound on a Monday, and then I went for the next one just 1 week later on that Monday. The second ultrasound, long story short again, concluded that the mass was unchanged, and I was diagnosed with a dermoid cyst with no normal ovarian tissue on my right side, which just killed me. You know, not having an ovary, like, are you kidding me? Like, I'm 22, I don't have kids, I'm just starting my life. I don't, like, how did this happen to me? It was really hard emotionally to wrap my head around that. And, you know, the doctor did say, you know, there could be ovarian tissue there, but we won't know until we get inside and see. So, so they scheduled me for surgery. So I had that second ultrasound on a Monday, and the following Monday I had my surgery. But the Friday before my surgery, I met with my doctor, who was back in town, my regular doctor, yay, I really like her. And I met with her and we discussed her surgical plan. She decided to do everything laparoscopically. There was talk about doing an open procedure since I wanted to keep whatever ovarian tissue I had intact. So we decided on the laparoscopic. She, you know, covered everything, like what medications I'd be receiving post-operatively, and, you know, the procedure itself and where my incisions would be. And it was good to meet with her because I hadn't seen her through this entire thing. She was on vacation, so I was glad to hear her, and she sounded confident that, you know, she can save normal ovarian tissue if there is any laparoscopically and all that. You don't want an open procedure for something like that because it takes so much longer to heal, and it's a bigger scar and it's more painful, higher risk for infection, and just not fun stuff. So she definitely felt that laparoscopic was the best way to go for me. So then I had my surgery on that following Monday. And I'm gonna get into my surgical procedure like in detail once I get through a little bit of medical information here. So I'm gonna talk about ovarian torsion now, and like what happens and the signs and symptoms of it, and why it happens basically. So an ovarian torsion happens, so you have these two ligaments that are holding your ovary in place, and it happens when those ligaments kind of twist around each other, and these ligaments have this the arteries and veins that go to your ovary to supply it with blood and nutrients and all of that. So it's called I'm gonna totally butcher this, but the indiolopelvic ligament and the turbo-ovarian ligament. So those two twist around each other and they cut off the blood supply, and it causes this extreme, sharp, sudden pain, which is to a T what I had. It's caused by, generally, an ovarian cyst. So what happens is your ovary weighs more whenever you have a cyst on it. So this causes an imbalance with the ligaments, and the ligaments aren't meant to hold that weight. So they kind of, they kind of give out and then they wrap around each other. So it's bad if you have a cyst. My cyst was about 5 centimeters. So that's a pretty large cyst. So that's definitely, since I came out of the ovarian torsion, they can't really say I 100% had one, but they think that it's extremely likely that I did. So basically, the reason why an ovarian torsion is a medical emergency is because it's cutting off the blood supply to your ovary, which can cause what they call an infarction or necrosis. So that just means the tissue dies, and it's not a good thing. So that would be an emergency surgery that they would have to go in and fix that and hopefully save the structures. If not, they take out whatever structures were affected. Normally it's just the ovary and those ligaments. So yeah, I talked about the signs and symptoms. Talked about the signs and symptoms, but so yeah, just that sharp pain. It's not where your uterus is. Your uterus is right above your pubic bone. It's not there. It's not where you get menstrual cramps. It's to either the right or the left. About an inch or two to the right or left where you get menstrual cramps. So, you can tell it's probably your reproductive system organs. It's not your appendix. Like, your appendix is higher up, but it's this sharp, stabbing, sudden is key, pain. So now I'm going to talk about what a mature cystic teratoma is, also called a dermoid cyst. You can get dermoid cysts in other parts of the body, but mine was in my ovary, which is actually common. You can get them really anywhere, but generally the gonads are that word's so weird, are where you get them. So the testes and the ovaries. So basically this type of cyst is actually a tumor. And it is formed from stem cells that are left from conception. So the people who have these are born with them, and they grow very, very, very slowly over time. The fastest rate they can grow is about 2 centimeters, I believe, a year, and people who have that definitely need to get them removed a lot earlier than the other people who have slow growing ones. If they cause you problems, you definitely need to get them removed. Generally it only happens on one ovary and not the other, but some people do have them on both. So they're kind of weird. If you ever have seen the show Monsters Inside of Me on the Discovery Channel, you've probably seen an episode of teratomas, and this is what that cyst is. So it's made up of bodily structures. So you get hair, teeth, skin, fat, you name it, it can be in there. And it's made up of my genetic information only. So it has my chromosomes, only one set. So it's made from a germ cell, which only has one set of chromosomes. So having said that, a lot of people, there's a misconception that this is your twin inside of you that you swallowed as a fetus or whatever. But that's completely not true. This doesn't have any other genetic information but my own. And it is a stem cell, an undifferentiated cell left over from conception. So dermoid cysts, unlike other ovarian cysts, there are many different types. They never go away on their own. They'll always be there. They're a tumor. So, you know, they're not filled with well, they can be filled with liquid, but like a simple cyst, which are very common. A lot of women get those just normally, but those go away on their own generally. So these never go away on their own, and they're, like I said, there are many different types of ovarian cysts. There are functional cysts, which would be the simple cyst filled with fluid, or the hemorrhagic cyst filled with blood, which would go away on its own. And then there's pathological cysts. So a dermoid cyst and like a neoplastic cyst would be considered pathological, meaning they don't go away on their own and they can be cancerous. So like I said, it's also referred to as a neoplasm, which just generally refers to as something that with abnormal cells that shouldn't be there. It's an abnormal growth of tissue. So there is a chance that these things can be cancer, which is really scary, especially like because I didn't know that I had this until, you know, it was very sudden that I found out that I had this. I thought I had normal reproductive parts. I had no clue that I had this. Never had any sort of, you know, inkling or symptom of it. So, so it's scary. But, you know, when you're younger, it's a less of a chance that it's cancer. And when you're older, it is a greater chance that it's cancer. So, there's about a 2% chance that it could be cancer. And yeah, so that's what a dermoid cyst is. So now I'm gonna kind of get into like my before surgery, and like my emotional process of coping with all this, and like meeting with my doctor, and, you know, risks of surgery and that kind of thing. So like I said earlier, I was just really struggling with this emotionally. It came on very suddenly. I had no idea, especially, you know, emotionally affected by the fact that I probably didn't have an ovary. That was really hard for me. I was worried about my other ovary, making sure that it was normal. And you know, it's just not a good day when you find out you have a tumor and you're gonna have to get surgery. So, you know, I had this all happen within like 2 weeks. You know, I found out that I had it, and then 2 weeks later I got my surgery. So, you know, those are really, really, really tough 2 weeks. I don't want to have to go through that again. So I had a lot of anxiety about the surgery, specifically anesthesia. I didn't know how I would react to it. I didn't know, like, I didn't want all these drugs pumped in me, and I didn't want really anything to do with it, which is normal. I mean, no one wants to have surgery, right? Like, it's kind of, you know, they're cutting into you. That's terrifying. The day before, you know, I wasn't allowed to eat past midnight, but like I couldn't barely eat during the day either, because I was so, like, I had such bad anxiety. I was so nauseous, and I had TMI, but diarrhea, and just, you know, just not fun. Like, it was not fun. And, you know, I knew that I had a potential to have an ovary, and I'm going back to this point because this is the most emotional part for me, but I knew I had a potential to have an ovary, but, you know, the doctors didn't seem like that was likely gonna happen. So I had to cope with that. I had to come to terms with the fact that, you know, I was probably gonna come out of this and not have an ovary. So yeah, and then I also had a lot of fears about recovery. You know, I didn't want to be in pain. They have to blow your abdomen up with gas. I don't want to have that. You know, it's uncomfortable. It's just uncomfortable. And, you know, body image issues. And I know it's like, should be like the last thing I should be really worried about. But I don't want to have scars. I don't want to have, you know, to heal from this. I don't want my body to look different. I like my body. I don't want it to look any different than it does. And of course, I had a lot of fears for my fertility. It's just, when you're losing a reproductive organ at 22 years old, it's just scary because you don't know what else is going to happen. Like, what if this happened to my left ovary and I had to lose my left ovary too, and then I freaking go into menopause at like, or I don't know, like I was making up all these crazy scenarios, which probably would never happen to me. But, you know, like I was worried about my fertility and my hormones and like feeling normal after the surgery. Oh, and a big one, like when I initially found out, like I was angry. Like I kind of went through like that cycle of like acceptance. But I was angry. I was like, why is this happening to me? I take care of myself. I'm healthy, for God's sake. Like, I'm vegan, like, and I know not everyone agrees with veganism, but like I eat so healthy. I take care of myself. Like, I want kids. There are people out there who, you know, shoot up heroin and they get kids and they have 2 normal ovaries, and there's a potential that I'm not gonna have children maybe, and I won't have an ovary. So there was all these, you know, anger towards like, why is this happening to me? I just felt like it was really, really unfair. And then I started to get angry towards my family members because they seemed all loosey-goosey about talking about this, which at the time, you know, it's my reproductive system. I don't want people to know. You know, I don't want your coworkers to know that I have a freaking tumor on my ovary. I was just really mad about that, and I know I'm making this video now, so I really guess I can't be mad about it. But when I first found out, I was just private about it. So yeah, I was angry about that. And then, so I guess I didn't say this, but I just graduated from nursing school, so I think this is a little funny, but like I was scared of like people seeing me like naked on the operating room table. And like as a nurse, it's like, from a nurse standpoint, that's kind of silly because we see that every day, and like it doesn't matter. Like, you look like another person to us. It's nothing. Like, it's not like we go home and remember it. But like I felt very introverted whenever I found this out. I just felt very uncomfortable. Like, I didn't want to talk to people. I got really like shy, and I didn't want people to see me naked. Like, I don't know. I just got like really introverted. So yeah, there were a lot of, that was the biggest struggle before, was the emotional struggle. So yeah. So when you go to get this procedure done, you will meet with your doctor before. Well, hopefully. Some people don't, I guess, if you're getting an emergency surgery or whatever. But basically, my doctor and I, we just went over everything. She said the full recovery is 2 weeks, and you know, you can do normal things, but you know, the first few days you're not gonna really feel like it, and then, you know, after that you're gonna have to kind of take it easy. Like, I'm not gonna go for a jog, and probably wouldn't do that before either, but yeah, so you know, it's full recovery is 2 weeks, and I definitely have to say at 1 week I still feel like I have a week to go. So no driving for 1 week, especially if you're using Percocet. I used Percocet for 3 or 4 days. I have the notes, I'm getting there, so I'll confirm that in a minute. And then you'll sign the informed consent. And don't sign that unless your doctor actually is like explaining things to you. They should be really, really going as much as in-depth as they can with you. And you should feel comfortable with the procedure before you sign anything. And, oh, my big tip for this is that you're not going to remember what was said during this meeting because you're going to have such bad anxiety. I did. And I recorded the... Alright guys, I don't know, my camera died, it got too hot, so I hope I'm starting at the right point. But I believe I was just talking about recording the meeting that you had with your doctor. Definitely do that. So let's talk about some risks of having surgery. And these sort of are general risks, so not particularly for this procedure, which would be an ovarian cystectomy, or some people get ovarian, I guess it wouldn't be ovarian, but an oophorectomy, which would mean you remove the entire ovary. So some risks just for general, like surgery, are bleeding. You're making incisions, your organs are being affected, you can bleed. Infection, obvious, you know, they're cutting into you, your body isn't meant to be cut into. You can get bacteria inside, you can get infections in your incision, you can get infections from being intubated. So yeah, that's a risk that you're taking. And these are minimal. Like, if you're healthy, really, if this stuff happens to you, you're probably just a really, really unlucky person. So these are rare. You can have adverse effects of anesthesia, which I will talk about because I had that. You can have damage to other organs. Basically, during a laparoscopic procedure or any other procedure, your organs are in there pretty tight. So like the tools can, you know, hurt your other organs. The anesthesia can affect your organs, specifically normally your liver, your kidneys. Yeah, and you can get blood clots, you know, depending on how long your surgery is and how long you're in bed for and all that. You're at risk for blood clots. You're immobile, and all the medications that you're using are kind of, you know, it's not what your body's used to, so you are at risk for blood clots. And even death. I mean, surgery is no joke. I mean, I'll get into my surgical story, but, you know, really, really just, this shouldn't happen to you. None of these things should happen to you, but they are risks. So yeah. So now I'm gonna talk about like the morning of my surgery, the actual surgery, and then we'll kind of get into post-op stuff. So the morning of my surgery, I was allowed, like I said earlier in the video, I was not allowed to eat past midnight the morning or the night before. So last time I ate was 11:45, which I suggest doing because you don't get to eat for a while. And last time I drank was 4:45 because I was allowed to drink until 5 a.m. And then in the morning I have Hashimoto's thyroiditis, so I took my Synthroid with a small sip of water. That's all I was allowed. So also they have you use this, I don't want to even call it body wash, but it's a medical antiseptic scrub. It's called HibaCleanse, and they will have you kind of scrub your surgical site the day before and the morning of. So that'll be in the shower. I didn't have any problems with it. I have really sensitive skin. It didn't really dry me out. I don't know. I didn't have any problems with it, so that's all fine. It does smell like medicine-y, but that's about it. So I had my surgery scheduled for 1 p.m., which is like, my God, I don't know how I'm not gonna eat for that long. Like, if you know me, I eat like every hour or two. So I was told to get to the hospital at 11 a.m. Got there at 11 a.m. and I didn't go back until like to the pre-surgical or pre-op unit until about 1. So they were running late already, which, you know, if you work in healthcare, you kind of get it. But it was a little bit annoying as a patient to be sitting there in the waiting room that long and being nervous and, you know, not being able to eat or drink anything. It was just nerve-wracking. Let's see, I said that. So I got back around 1, and they had me like change into a gown, and You know, I had to put all my belongings. Okay, so my camera keeps shutting off, so this is gonna be a little choppy, but I believe the last part I said was that I put all my stuff in a bag and all that, and I went to go back to the pre-op area, and they put in an IV and started fluids, and that's pretty much all they did, a little assessment, and that was it. So then my family came back and they hung out with me for probably like 20 to 30 minutes. And then I went back to the OR at 2, but I didn't actually get into the OR until 3. And then my surgery took about an hour. So let's talk about anesthesia. I am not a huge expert on anesthesia. I wish I was. I think it's fascinating, but I don't particularly like it. So I tried to get as much information as I could for you guys, and having a little bit of a nursing background helps. But so basically, first, like, your family will be with you and they'll give you something in your IV, and it's midazolam, which is for sed, and it's a sedative, so you'll start to feel real sleepy. And for me personally, I don't remember a thing after that, so they give you that. Well, I remember little bits and pieces, nothing really, like, I don't remember getting on the OR table, I don't remember leaving the OR, all I remember was waking up in recovery, and that's really it. So they give you midazolam, which is a sedative. And so I talked to the anesthesiologist, real quick side note, and I told her to give me a list of medications because I wanted to talk about them. And she said that she doesn't give all of them, but these are all the ones that I could possibly get. So they give fentanyl, which is used to sedate, and it's also for pain. They give lidocaine, which is used for incisions and intubation. They give rocurium, which is a paralytic. They give propofol, which blocks memories and also decreases consciousness. They give succinylcholine, which is a paralytic used for intubation. There was a medication that she said called desforine, but I looked it up, couldn't find anything on it. I might have misheard her, I don't know. She said they might give me nitrous oxide, which is laughing gas, which just keeps you kind of relaxed. They give you Dilaudid, oxycodone, which are both for pain. They give you Zofran for nausea. They give you a medication called Decadron, which is dexamethasone, which is a steroid, which is basically if you were having, like, I don't know, swelling from your intubation or whatnot, they probably give that. Then they give phenylphedrine, which is a vasoconstrictor, and she also said another medication, which was a vasodilator, but I don't remember what that was called. So yeah, you get a cocktail of medications, and for me, like, I'm teeny tiny, I was scared. I just, you know, I didn't know how they were going to affect me. I've never had an opioid before, and now I was given, you know, fentanyl, Dilaudid and oxycodone, and then I was going home on Percocet. Like, I didn't know how I was going to react to that. So, so yeah. I'm going to talk about, like, getting off of anesthesia after I talk. I'm trying to do this in order, so I'll talk about it after I get done with what they do during surgery. A laparoscopic ovarian cystectomy, or oophorectomy, they put you to sleep under general anesthesia. Then you are intubated. Then, you know, they do a whole bunch of things that I don't really know. I know they put on a level of consciousness thing on your head. They might start another IV. They put in a Foley catheter. Excuse me. Then your doctor will do a pelvic exam. This is an in-depth pelvic exam. It's done under general anesthesia. So it's not like how you go for your annual OBGYN visit. So she's really trying to fill this ovary from inside of me, which freaked me out because I don't really want to be penetrated while I'm asleep and unconscious. But yeah, so they do that. Then they make the first incision, which is at your belly button. They insert gas to blow up your abdomen so that your abdominal wall isn't laying on your organs, so they can move around in there with their little tools. Then they they insert a camera, they look around in your abdomen, and they make the other incisions based on what it looks like in there. Then the operation begins. Alright guys, let's hope that's the last time my camera does that. But anyways, so during the operation, they will cut through your ovary wall, and then they will peel out the cyst from that. So my procedure took about an hour, and now we're getting to the fun part, my experience waking up and my experience post-op. So waking up from anesthesia for me was, I don't know what happened. I don't know if they gave me too much. I don't know if I just react to it really badly or what, but it took me a really long time to wake up from anesthesia. They said it should be almost instant, and it took me, I think, 2 hours, and not even, like, I wasn't even fully awake at the end of the 2 hours. Like, I was, like, first opened my eyes. So, that was really scary. So the first time you'll open your eyes, everything will be blurry, and each time you open your eyes after that, it'll be more and more clear. But it really took me a while to wake up. And then, so I got out of surgery. My surgery started at 3-ish. I got around 4-ish. I didn't wake up until 5:30-ish, a little bit later. I didn't get to see my family until like 6:30, and I didn't end up leaving the hospital until 9 o'clock at night, which usually doesn't happen with laparoscopic procedures. Normally people are out within an hour. But I really struggled with anesthesia. Even after I had like woken up, I struggled to stay awake. I kept falling asleep, and they didn't really know what was wrong. They kept just saying, oh, you're really small, like you just, I don't know. They just kept saying you're really small. I'm like, well, all medication's based on weight during anesthesia, so what, did you give me too much? Like, I don't know. I would really like to see the anesthesia notes for that. But yeah, so it was really kind of scary waking up. So now I have 3 incisions, one at my belly button and one at each hip. My left hip is right on my hip, and my right incision is like an inch in, excuse me. The one on the hips are like 1 centimeter, which is teeny tiny. My belly button is 2 centimeters, which is still pretty small. So eating, like I said, I wasn't allowed to eat from midnight on, and I did not end up eating until like 40, so from midnight, didn't end up eating till the following midnight, and then I didn't end up eating till like dinner time the next day. So it was like almost 48 hours. It was terrible. Anesthesia just made me so nauseous. I was throwing up. I threw up like 3 times. I think more than that, but I don't remember. I got home from the hospital, and I was due for my like medications, my pain medications and all that. And I threw up everything. I was so scared that I wasn't going to be able to keep anything down, and that I'd have to go back to the hospital and get an IV, because at that point, being home, I was in pain. Yeah, so I never want to have to go and do surgery ever again, or have anesthesia ever again. That was terrible. One of my arms, this is kind of not typical, but it happens. One of my arms was infiltrated, which means they put an IV. I have bruises on my arms. I don't know if you can see right there, but they put an IV in this arm when I was asleep, and the IV wasn't in my vein. It was in the surrounding tissues. So my arm was this big around, and I have really skinny arms. It was double the size of what it is, and that took about 24 hours to completely go down. And it's sore, like it's still sore, like down in here. I was on Percocet for the first 3 days after surgery. I just felt like I was in enough pain to take it, and every time I took it, I was asleep half an hour later. So, I mean, that was nice, I guess. I mean, I didn't want to be awake for so long, and the amount of pain I was in. I was just uncomfortable. The gas pains that you have are just so uncomfortable. and I'll talk about those a little bit. I took Motrin and Tylenol after I got off the Percocet. So I would take Motrin, and anytime I felt like I couldn't make it to my next dose of Motrin, I would take a Tylenol to hold me over. Yeah, so the gas pains, they're terrible. Oh my god, like, I still having gas pains. It's not nearly as bad as it was, but every time I breathe in, it's like right in between my ribs where my diaphragm is, I feel like a just bubble moving. Not like a bubble, but like, you know, movement. And it's, your belly's bloated, and it's hard to take a deep breath, and you have these incisions too, and they're sore, and you can't really deeply breathe, and you can't cough, and you know, it's just very uncomfortable, and it is for a long time. The first time I could take a deep breath was 3 days post-op, and then I'm still having gas pains at 7 days post-op. Not nearly as bad. The only time I can really tell that they're there is when I'm like in bed and I'm like rolling and I can feel it move, but that's about it. And so like, they give you this medication called simethicone, which is to help with removing the gas from your body through your bowels. I didn't fart like a lot, like I'll be honest there, didn't really fart a lot, but I am burping a lot, so there's that. And also they blow up your stomach with CO2, so when you're in breathing, that CO2 will be taken up and should be expelled via your respiratory system as well. So, but I am burping. Oh my god, and this shoulder pain from the gas is just, it hurts, guys. Like, it's no fun, I'm not gonna lie. So what happens is this gas kind of builds up right underneath your diaphragm, and you have a nerve there called your phrenic nerve, which has a lot of nerve endings in your shoulder. So the shoulder pain's like here and kind of where your shoulder blade is, and it hurts. Mine was really bad on my right side, but it was sort of bad on my left. But now, like, I still have a tiny bit of shoulder pain, nothing like the first, you know, couple days. I didn't really feel the gas pain hit until about 24 hours after, though. So my incisions don't really hurt anymore, but they are bruised. So you know how like a bruise hurts? It's kind of like that. And they're kind of itchy. So I've been putting Neosporin on them. My belly button, guys. It looks like a Cabbage Patch Doll's belly button. It's swollen. I hope it goes back to normal. I mean, I didn't have like a cute belly button before, but I've never had like a full innie, but right now I have like a full outie. Like, it's out there. And it's not pretty. So they said that I could have some vaginal bleeding afterwards. I have not. I have not bled at all. I'm expecting my period soon, so they said that might also be a little bit different. It could come a little late, might not come at all, that kind of thing. My first bowel movement was 3 days post-op, and I was constipated the first time, and I have had diarrhea ever since. So that was 3 days, and I'm at 7. I mean, it's been a while that I've had diarrhea. It's just a pain in the butt, and I don't know what's going on. I'm off all medications right now, so I know it's not a side effect of the medications. I'm not really sure what's going on with that. I feel like I had a cold. I feel like today is the best I've felt. So 7 days post-op was good. But I feel like I was also struggling with a little bit of a cold. I'm a little bit stuffed up. So I was having some flu-like feelings. Never really had a fever or anything like that. My incisions look great. Like, I'd be pretty keen to spotting an infection. I am a nurse, so, you know, I'm keeping an eye on that. But, you know, I just didn't feel well, and it wasn't my belly. It was like my sinuses. Like I had a cold. So yeah, so I'm still having diarrhea. 7 days post-op. Not sure what's up with that. So I did get into the medications that you'll get a little bit, but like I said, my doctor prescribed me Motrin, which is for the pain, and it's also great for inflammation, so take this. I know maybe you'll just take the Percocet, but take the Motrin because it helps with the inflammation of the incisions, internal inflammation, and anything like that. Percocet, which is for the pain, I took that for the first 3 days. I think I got a bottle of 20 and there's like 9 left or something like that. So, I mean, I didn't take the full bottle. Simethicone, which is for gas, I took that the first 5 days. Zofran, which is for nausea, I took that the first day only. And Colace, I took, which is for constipation, I took the first 3 days until I had my bowel movement. And I thought maybe that was giving me diarrhea, but I haven't taken it in a long time and I'm still having diarrhea, so I don't know what's going on with that. Mentally, my recovery has been, it's been pretty good. I wasn't really expecting to, have it take this long to feel better. I was kind of expecting to like bounce back like, 2 days later, I'll be fine, feeling like a normal person, but just have these incisions. Like, I wasn't expecting to be, like, I was in bed for 3 days. I just got up to go to the bathroom. That was it. So, I really wasn't feeling well, and like, I would say the last like 2 days have been really good, but up until like this point, I haven't been feeling well at all. So I really wasn't prepared for that. And like, I feel like maybe I'm a wimp. Like, I don't know. I feel kind of like upset that it's taken me this long to recover. So I don't know. The gas pains are uncomfortable. I've said that. You guys probably get it. I was so happy that, I don't know if I've said this, but my doctor saved my ovary on my right side. There was a little sliver of normal ovarian tissue, which I'm going to insert a lot of pictures at the end of this, of my scans and of the surgical procedure itself and all that. But she saved my right ovary, so I am very happy about that. And, I'm just glad it's over. I don't want to have to go through this again. So yeah, 5 days post-op on Saturday, I got a call from my doctor with the results from Pathology telling me what was in my, my tumor, and she said that it had a little bit of everything. So mine had like hair, fat, teeth, I don't know if it had eyeballs or thyroid gland, I don't know, but her words were it had a little bit of everything. So yeah, so it took me 5 days to find out. So the big question is, how is this going to affect my fertility? And the answer to that is that it really shouldn't. Obviously, people have normal reproductive systems and they have issues with fertility. So, I mean, I could have issues with fertility, but it might not be because I had this cyst, and it might not be because I only have a little tiny bit of my right ovary left. It might just because sometimes that happens and there's really no explanation. But it really shouldn't. So I'm thankful for that, and I won't know until I try to have children. But one thing that this whole ordeal did do for me is it really made me think about my future and when I wanted to have kids, because I went into this whole thing thinking I was losing an ovary and thinking that, I know my doctor told me from the get-go, even with one ovary, like, you'll be fine, you shouldn't affect your fertility at all. But, it made me consider maybe having children earlier than I had originally planned. I mean, for heaven's sakes, I just got my IUD in. Like, obviously I don't want kids right now. But I do want kids eventually. But, so I'm kind of reevaluating that, and, like I said, I'm just kind of starting out my life. We'll see where I'm at a year from now. But, originally I thought like maybe I would wait like 5 years to have kids, but now I'm kind of thinking I might want kids before that, so we'll see what happens. And And now I'm gonna give you guys a little bit of an IUD update because this all happened within one cycle. I got my IUD in, I got the cyst removed and everything. But basically, I had the Paragard IUD inserted on August 3rd, like I said in the beginning of the video. Blog down below about that. But if you want to hear about the insertion and all that, that's all down below. But basically, I haven't had any issues with the IUD. I cramped for the first 24 hours, I spotted for the first 4 days, and then I spotted randomly throughout this cycle, like for, you know, not even a full day. Like I would wipe and there'd be something there, but nothing on my underwear. So no issues with bleeding, no issues with cramping. I did have for the first 24 hours, and then I'd have it randomly, like for an hour here or there, for maybe like 3 days out of this whole cycle. So really, like, I don't have any complaints. I'm about to get my period, so we'll see how this period is. I'm a little bit nervous, especially after just having surgery, but no complaints on the IUD side. So please let me know if you guys have any questions. I would love to, you know, talk to people. I'm a nurse. I find this stuff fascinating. If you have any questions, please let me know. I hope I answered some of your questions and made you feel a little bit better about the procedure or whatever's going on with you. But thank you so much for watching, and I hope you guys have a great day. Okay, so this first image shows the cyst, which you can see in the 4 little quadrants on the left, and the lower left-hand quadrant shows the blood flow to my right ovary. The second picture shows the cyst as well, and it shows my fallopian tube. That was at my first ultrasound scan. And then the third picture was at my second ultrasound scan, which clearly shows a cyst there. The fourth picture is a picture of my incisions post-operatively. The fifth picture is a picture of my uterus, my left ovary, and a little functional cyst on my left fallopian tube, which should go away on its own. The fifth picture shows the uterus, the tumor, my left ovary, my left fallopian tube, a little bit of my right ovary, and that left functional cyst as well. So you can see the size of my cyst was about the size of my my uterus. The sixth picture shows my tumor with that little part at the top of that. You can kind of see a circle is the little bit of remaining ovary that I had left. The seventh picture just shows the uterus and the ovary, and as you can see, like, my left fallopian tube and my left side is kind of pushed out of the way because of the size of my tumor. And the remaining picture is what's left of my right ovary, and once that heals, I should ovulate from that side, and it should not affect my fertility at all.